says that we're preparing to live stream. And I'm also going to record in the cloud. Okay, we are live. Hello, everyone. This is Dr. Jennifer Gardella, and I am honored to have with me today Dennis Pfleiger, who is one of the directors of our hospitals here that BCHIP is closely associated with. So he runs St. Luke's, and we are going to hear from him in a minute. I want to say that here at BCHIP, we have awesome partnerships with our local area hospitals to promote the good work that everyone is doing to improve the healthcare in and around the greater Bucks County area. So Dennis, thank you so much for being here. You guys are an integral part of the work that we do. Why don't you tell us a little bit about St. Luke's?
Sure. Well, thank you. And I'm glad to be here today. A little bit about St. Luke's. So we're fortunate. We're going on our 30th year. So in 2025, it'll be 30 years since Quakertown Community Hospital joined St. Luke's. So we're excited that we've been a part of this community as St. Luke's for the last 30 years. The last 5 years have really been an incredible journey for us. We moved from our original campus over on Park Avenue to a brand new facility out on Route 663 and Portser Road, where for the last 5 years now, we've really been in a tremendous growth mode. We opened a new campus. We have continued to expand our bed count. We've added new services, with one of them being obstetrics. We started doing obstetrics here in 2021. So it was the first time since the 1970s that we've delivered babies in this market for St. Luke's, and incredible. And a year and a half ago, we opened up a brand new women and babies pavilion then to create a great birthing experience for our moms and the little ones coming into the community. So we're excited about that. We also have a brand new cancer center. So we have 16 chairs of infusion therapy plus radiation oncology, and we brought our medical specialties for the cancer program all here onto this campus. So it really makes a nice experience for people who have to go through cancer care, that they don't have to travel all over the place. They can come to one location and their entire team is located here. So we're have been doing very well, bringing new services into the community. We also expanded mental health services. At our campus over on Park Avenue, we went from a 19-bed behavioral health unit to a 32-bed behavioral health unit. And we're continuing to try to really meet the needs of people here in Bucks and Montgomery counties. So we're really excited to continue to grow those programs that are so needed in our community. And next month, we'll be starting to have an emergency room expansion. So we're looking to add 11,000 square foot to the hospital. It'll basically add another 14 or 15 beds of emergency medicine to our campus, which is much needed as we've outgrown our current emergency room space. So that'll take us sometime into the later part of 2025 to complete, but we're excited to have that underway as well.
Wow, and there's really a need for more ER services.
Yeah, when we started here several years ago, we were, 16, 17,000 visits a year. We're up to about 28,000 visits a year now. So tremendous growth at our campus, which is, we kind of outpaced what we thought we'd have here in our emergency room already, which is great to see.
That's amazing that you guys are really taking a look at what's needed and then expanding the services that you're offering. Thank you for
and that's the part that I think is amazing. As we met with the community before we opened the new Upper Bucks campus, we talked about what services were people looking at from our community. What did they want from St. Luke's? And really the two programs that stuck out to the community were they wanted enhanced cancer services and OBGYN services. So it's great that we're able to say that we delivered both of those to our community.
Yeah, and the mental health piece, so important. Everyone has, keeps in any healthcare field is pointing towards the importance of mental health, both inpatient and outpatient. And it's so hard to it's so hard to, first of all, take that first step for many people, but it's also so hard to find good services.
And that's where I think, for us at St. Luke's, we've been very fortunate. We had the chance several years ago now to partner with Penn Foundation, which is a large community outpatient psychiatric and also substance use disorder facility. And, they joined St. Luke's, and now it's really, we just rebranded it this year, and it's now called St. Luke's Penn Foundation Mental Health Services, to really show the breadth of comprehensive mental health services across our entire network.
Great, great. Thank you for explaining all the wonderful things
Sure.
that you're doing up there. So we're here to talk about you and highlight your services and also talk about BCHIP and how the hospital systems and BCHIP kind of work together to form this great partnership, which I know was very instrumental during COVID. So why don't you talk about that a little bit?
Sure. I think, it's really a platform that you don't see anywhere else. To have all six CEOs meet on a regular basis to talk about healthcare across an entire county is really something you don't see in many areas. So, you know, um, it started out with simple things like relatively simple, working through smoking cessation and bringing the B cares, which is our bringing recovery specialists to each of the campuses across Bucks County. All of those type of programs are really needed, and it was great to have a single point place to start to deal with those issues across the entire county. When I really felt that I saw the true power of what BCHIP can bring to us, it was really during COVID. And during COVID, the six CEOs, along with all their other different members of our teams, met on a weekly basis really to talk about what was going on, what were we seeing, what was the messaging that was going to need to be done, what resources could we help each other with at different points in time. And truly having that ability to collaborate across the entire county to me was a absolute needed thing during that time. We saw in many other counties where those things didn't happen, and messaging was sort of a little more disjointed. It wasn't, whether we were allowing visitors, not allowing visitors, masking, not masking, all those things we had a chance to discuss and come up with a plan across the entire county that worked for the organizations involved. And after COVID now, we continue to work on new things. I mean, we're still working, they help with our drug take back programs and getting that information out. And there's a lot of great information that, BCHIP is able to help get out across the entire county. As much as we all push our own social media things, BCHIP does have another set of audience members that may not be attached to any one of our health systems. And at the same time, it's able to show where they can receive services. They can also find those resources for other needed services throughout the county. And, BCHIP has really done a nice job. They've worked with us on our staffing and recruitment issues and trying to find programs for people to get into to help alleviate the staffing shortages that we've all experienced. So, it's really been a very collegial opportunity across all these campuses, despite most of the time we're competitors, right? But at the same time, we can all look at these things and realize that we can work together to improve the health of our entire county.
Yeah, that's wonderful. And I think certain programs, homebound vaccines, like you said, drug take back, there's no reason for all of you guys to be doing those things on your own when they can be centrally offered, because sometimes, a larger institution like yours can't really
Mhm.
handle a piece by piece. But when we
Right.
look countywide, the numbers are there. So it has to
Right.
be handled by another organization. That's great. Okay, well, did you have anything else you wanted to add?
No, I just think, again, I think this is, again, I think it's a model that people should really look at in other areas because I do think there's some benefit to it to really enhancing healthcare across an entire county.
Yeah, when I first was introduced to the concept of BCHIP, I remember I thought to myself, oh my gosh, they all talk to each other? Like, how novel is that?
Yeah.
Right?
Right.
That's awesome. And to address issues of long-term care that and just what you said, staffing is an issue across any industry these days, but to be able to get a handle on it, and now there's money through the county to get training for your people and to have all of that sometimes centrally is not centrally, housed is
Mhm.
not good. But the way I think that Kim and the team kind of set things up, it's accessible
Right.
and realistic, which is a beautiful thing to have these days.
And a lot of times it's just about knowing what resources are even out there for us as health systems. There's a lot of times, I mean, there's differences in the county. Bucks County is a very large county
Yes.
and it's an extremely diverse county. Everything from being a true suburb of Philadelphia to more rural areas like in Upper Bucks. And our issues are different, but yet at the same time, there's a lot of things that are very similar across the entire county and trying to figure out how to continue to enhance services and just and communicate with each other is so important. And we get to learn from each other at the same time. There may be services that one of the other one of the other presidents have gone through. It's a great opportunity to be able to pick their brain a little bit about how did that work for you and what was the impact to the community in your area. And those are the things that give us better ideas to improve it across everybody. So
Yeah, and while you make an excellent point about how you are technically all competitors, if you go down to like the lower parts of the county, Bensalem, not Quakertown, sorry,
Yeah,
but
yeah.
those lower Levittown, right?
Yep.
Then the center, the middle part, and then the upper part, they are actually three different planets sometimes where people need very different services. And so
Right.
it's great to be able to know your local area, but be able to draw from the collective community. So
Yeah, because there's things that, we start to see in Upper Bucks at times. We have transportation issues up here. We probably have a little more of a, at times an elderly isolated groups because they don't have the other services that sometimes they have in Lower Bucks. And, it's great opportunities for us as healthcare systems to make a difference. For us at St. Luke's, we've done things with our youth for summer meals program. So from Memorial Day to Labor Day, we do meals Monday through Friday for the kids in the community that are in need, and they leave with a bag of community supported agriculture. We do this. We have some people that have helped sponsor these programs with us, but it's really, I think we did something like three or 4,000 meals this summer, which is amazing to see that amount of need. We do a summer, an evening meals program now for our seniors. So Monday through Friday from 4 to 6, they can come here and receive and get a meal for $3.99. So they're great ways for the community to be able to take part in healthcare. And it's not just about coming to the hospital then. It's not just about being here when you're sick. It's about being here for the long term with you. And I think that's something that, there are a few of the programs to me that are really special here that meet a need in our community that, some other communities may not have that same need, right? But they're ways that we can all touch each other's and touch the lives of the people that we're serving. So,
and that community that you're providing, I mean, all of the experts are saying now that healthcare is great. We need all of that. We need to eat healthier and
yep.
exercise. But that sense of community and someone cares and you have someone even to talk to over a
Yeah.
meal is a beautiful thing.
It's
Well
amazing to
done.
see the community that has evolved around these things. We watch the adults come over in the evening and they're moving the tables around in the cafeteria to line up their groups and get them ready to go. And they're it's great. So it is amazing. It gets people out of their homes, stops being, you don't have that isolation issue. And for the kids over the summer, I mean, it's a great way. We do it at a park here. We have a skate park here in town, so it gets them outside, it gets them into the community, finds a group of people to be around them. All those things are extremely healthy. And, you don't see the impact of these things maybe for years and years to come. But we know that, if you eat healthier over the summer, you're not going to gain the weight the kids normally tend to gain over the summer that are sedentary all summer. So these are all great things that have a long-term impact on the lives of our youth in the community.
Wonderful. See, there is a lot of depth here. You're going to have to come back.
Oh, perfect. I'd be happy to.
We would love to have you back. So again, thank you so much for your time. And really, anytime you have a new program or you think
Okay,
that it's a new season and you want to talk about something else in the community, how BCHIP may have helped or
great.
something that we need to work on, please come on back.
All right, sounds great. Hey, thank you for your time today. I appreciate it.
Thank you and have a wonderful holiday.
You as well. Thank you so much.
Bye.
Bye-bye.